cucurbitacin paralyzes the worms. They release, and then you just pass them in the stool. And so that's a great way to get rid of them.
And pumpkin seeds are a natural laxative, aren't they?
Yes, they are. But if you take a lot, you're going to get a laxative effect. So what I like to use for patients is we use the pumpkin seeds, 1 teaspoon, usually once or twice a day, usually twice. And then the fiber zone. The fiber zone just literally pushes it all out. And then you look at the stool, and many times you'll see the worms coming out.
This is Dr. Colbert's broadcast, and we are back with my dad, Dr. Don Colbert, my mom, Mary, my wife, Meredith, and we are talking about parasites. Now, we went through all the terrifying things parasites do. I hope you give us some solutions.
I am, but first, let me ask you, what would you think would be the most common worm parasite that Americans have?
I always heard the ringworm. You know, you work out.
That's a fungus. That's a fungus.
Oh, really? So ringworm isn't even a parasite?
You know what the most common worm infection is? You should. You've had it. Pinworms. About 40 million Americans have had pinworms. It usually occurs in young children, around the, just young school-aged children, around 5, 6. They get it at school, pass it along. They dig their fingernails in the roll and give it to a friend and share their pinworm eggs with their friends. But pinworms are spread through fecal oral contamination.
Oh, my goodness.
See, pinworms cause intense itching in the perianal area and in the vagina of little girls. And it causes just tremendous itching and loss of sleep. So they're scratching and itching. And then they're spread there. They get under the fingernails, and whatever they touch or whatever they handle, they're touching surfaces. They're leaving their pinworm eggs there. It's in the sheets. The worms come out at night. And that's when they come out, is at night, and then they crawl on their skin, on their legs or arms, and when they wake up in the morning, they lay eggs on these areas. The eggs hatch, and it looks like worms coming out of their skin, but they're just hatched eggs. And so, again, they're nothing to worry about. They're just a nuisance, but female pinworm can lay 10,000 to 16,000 eggs a day. And they hatch, and that's a lot of little pinworms that can come out. So they freaks people out when they'll see all these little teeny.
With Lysol soap?
Soap and water helps. You want to get them in the shower, but we got things that kill them. I'm going to talk about it in just a sec. What happens if the child scratches the area or if they touch other family members? They transfer their eggs to the family member. So you have to treat the whole family. The key is just hand washing your hands and cutting the fingernails. That's the most important. And then treating. The treatment's real simple. You give them 1 pill of Vermox or mebendazole, 100 milligrams now, and you do it again in about 2 weeks. Each family member got to treat every family member, and it kills it. And that's because they're highly contagious. There's also a parasite cleanses that work that are over the counter, like Parapurge, P-U-R-G-E, and you can take that, again, as indicated on the bottle. If you're real small, you don't take much. But again, you can also use pumpkin seeds. Pumpkin seeds are amazing for parasites. Most people will just start with a teaspoon a day. Pumpkin seeds have a phytonutrient amino acid in it called cucurbitacin.
Curcumin.
It's almost like curcumin, but it's called cucurbitacin. And this literally paralyzes the worm. So it's in roasted pumpkin seeds, regular pumpkin seeds, not in pumpkin seed oil.
It right out.
And so what happens when you take pumpkin seeds, 1 teaspoon, just chew them up. You got to chew them. And then it releases that cucurbitacin. Cucurbitacin paralyzes the worms. They release, and then you just pass them in the stool. And so that's a great way to get rid of them.
Pumpkin seeds are a natural laxative, aren't they?
Yes, they are. But if you take a lot, you're going to get a laxative effect. So what I like to use for patients is we use the pumpkin seeds, 1 teaspoon, usually once or twice a day, usually twice. And then the fiber zone. The fiber zone just literally pushes it all out. And then you look at the stool, and many times you'll see the worms coming out. See, doctors, when they check for this, they do stool for ova and parasites, but they miss it many times, because you have to have 3 ova parasite stool specimens usually to catch it. So you usually miss it. You can do PCR testing, which will check it. A lot of doctors used to do the tape around the anus on the slide, and you can see the pinworms when you do it at night. But again, it's so easy to treat. You just treat it With the Vermox is the simplest. Treat all family members and boom, you're done.
This is such a medical show. I mean, this
Yeah,
is like typical dinner table conversation in our family.
You're right, sure.
Growing up.
But I'm sure this is difficult for the people to listen to.
But pumpkin seeds are just wonderful at clearing this. Just a teaspoon, chew them once or twice a day. Usually does a trick for, 5 to 7 days or longer.
It just makes me think when I was young and Meredith, when we were first dating, our friends would come over for dinner. These would be the conversations that we would have.
Yeah.
Literally at dinner. And
Meredith wouldn't need any.
And her guests, whoever would be with me, would be just sitting there eating, and then they would just stop and listen. They just put it down. You just lose your appetite. And so now it's a very...
You know what? We have a joke, that hanging around Dawn, eventually the conversation ends up in the toilet.
It always does, and that's what I thought about.
Well, let's talk about the most common.
Hold on, because there's so much information to be packed in.
It is a lot.
The important thing is for people to know there are real answers to get rid of these things.
Yes.
This is not a curse that you're going to be stuck with for the rest of your life.
And for many times they play themselves out. And for most of the people watching, they're adults, they're grandmothers, they're mothers themselves. And they're more concerned about, yes, their child, but is this going to spread through the house? Is this something that they have to be worried about long term?
There's nothing to worry about. Pinworms don't cause any long-term problem at all. It's a nuisance, and it grosses people out. It's the gross factor. They don't like the gross factor, but these are little teeny worms. You can barely see them.
You don't want worms in your body? Nowhere.
They don't cause
Let's talk about ones you do need to be concerned.
We are. That's why I'm talking about giardia. Giardia is a protozoa. Now, this is a single-cell parasite. And giardia has a flagell or a tail on it. So it infects the duodenum, the first part of the small intestines, and it causes terrible diarrhea. It causes bloating, swelling, gas, and a unique stool smell that's horrible. And so you get this from the bad waters in the lakes, especially in warm weather. We have it in all the lakes pretty much in Florida. And if you go skiing a lot and you swallow the lake water, you're going to get it. And then about a week or two later, you get this horrible cramping, gas, bloating.
A week later, so not 24 hours later.
No, usually it's a week or so to really inflame.
They have to lay their eggs.
Yep, they lay their eggs and then they infect your system majorly. But it's easy to kill. You diagnose it, and you can easily diagnose it with just PCR testing, or you can do a stool for ovarian parasites, but that usually misses it. The way you kill it is just Flagyl or metronidazole.
Okay, so
low dose.
Let's go to symptoms real quick.
Well, here are the symptoms. Diarrhea, very loose stools, abdominal cramps, nausea, vomiting, gas, bloating, and it has a unique, distinct stool odor that's really bad. And so this is...
that's interesting.
And so you can... I've had it so I can smell it if someone has it, and I can tell immediately.
So it's not just a different odor for every person. It's a distinct odor for everybody.
It causes, because this
parasite,
it infects the duodenum, and it causes this unique odor of the stool.
Interesting.
And so, again, the drug of choice is Flagyl. It's simple to clear. It takes 5 to 7 days to clear it.
But see, what's tough is there are so many issues that humans can have with those symptoms. Bloating, diarrhea, nausea, upset stomach. Those are symptoms that you feel for, sometimes every day.
But what happens, it tends to come and go. You're fine for a week or so, and then boom, it hits you. And then you have to run to the bathroom. That's what happened to me. So it took a little while to recognize it. And then finally I got it, I did a stool culture and all. And
stool culture?
Stool culture for ovarian parasites, and they found the parasites in it.
So your local doctor, you go to your local doctor and say, I'd like a stool?
Yes, or you can do PCR tests. We have these new tests called PCR, polymerase chain reaction, where it actually checks for the DNA of the parasite. So it can tell you instantly if you have it. So it's really cool testing.
Is that an online test? Or
well, you can do it online. You can. We use gut zoomer testing, but you can do different online tests that do PCR checks. There's a GI map, there's GI effects, there's gut zoomer.
So you can get tested without even having to go to your doctor.
Usually you can. You can find these, they're wanting to do these tests, and it's easy to treat. It's really easy to treat. So Flagyl is the drug of choice, but there's other things you can use like Parapurge. Parapurge contains fenbendazole, a cousin to mebendazole, and ivermectin, and it helps it too. So
ivermectin, we've heard that before.
So it's a combo.
Right, and it's a combo that you get online, and it'll clear many times the giardia.
You can get this online. Wow.
Yeah, you can. So that's a really cool thing. Now, one of the most common parasites in the U.S. is Trichomonas. It is one of the main causes of sexually transmitted diseases. It infects 3.7 million people, around that many, every year in the U.S. And it's another protozoa, a little single-cell parasite that is sexually transmitted. And women get usually a foul-smelling, frothy, yellowish-green vaginal discharge, along with vaginal itching and burning, and many times burning on urination, pain and burning on urination. Men will just usually get a discharge from the penis and pain and burning on urination. And women are more likely to get this than men, but the drug of choice is the same as giardia. They're cousin parasites. They're both protozoa.
Commercials.
Yeah.
Is that the same, like the pharmaceutical commercials, giardia? I feel like I've
Yeah,
seen
there's
this. Yeah.
well, no, but giardia and trichomonas are cousin parasites. Giardia affects the small intestine. Trichomonas affects the vaginal and urethra.
Okay.
And so they infect different organs. Similar flagellated, so it's got a flagella that is a motility.
And there's nothing natural for this. You have to go
Well, there are. No. Like I said, you can take the Parapurge, and Parapurge helps.
Parapurge is a supplement.
Yeah, it's a supplement you get online with thenbendazole and ivermectin.
Okay,
You get that online.
When I think of ivermectin, I think you have to go see a doctor to get a prescription.
Not with this one. You don't have to.
Okay, great.
But the drug of choice for trichomonas is metronidazole or Flagyl. Just a one-time dose of 2 grams, 2,000 milligrams, one time, or you can take 500 milligrams twice a day for 7 days, and the sexual partner has to be treated. And you say, well, how do I know if I have this? There's a test you can do called the nucleic acid amplification test, and it's the gold standard for diagnosing. You get one online. That's the nucleic acid amplification test. You get it online, or most doctors' offices do it, the ERs do it, the GYNs do it.
So what is the test? Is it urine? Is it bowel? What is it, blood? What kind of test?
It's a test of the vaginal secretions.
Oh, so you like swab, you're
Yeah.
going to be swabbing yourself.
I think most people would go see their doctor if they start having symptoms like that. Yeah. So it's not really something people want to take.
But most doctors use the Flagyl or metronidazole. It clears. It's drug of choice. Now, there's other natural ways to treat it. There's boric acid suppositories, vaginal suppositories. They use the suppository twice a day. It makes it the area acidic, so the parasite's less likely to grow.
Interesting.
And there's the garlic suppository for the vagina. They actually take a garlic clove, make sure you don't nick it. You wrap it in a little small gauze to make like a tampon. Then you soak it in coconut oil and insert it in the vagina at bedtime for about 8 hours, and do that for about 5 days or longer, and it usually clears it.
I used to manufacture a supplement years ago for a customer who wanted a custom boric acid supplement. I didn't know what I used it for, but I bet it was this.
Right, sure. And then now the next one is Toxicera. These are the parasites that are found in your dogs and cats. It looks like this. You can zero in on this. These are parasitic roundworms, and these are the eggs are in the dog's poop. And then so what happens is the dogs roll around in their poop, and as they roll around in the poop, they get the eggs on their fur, and we pet the dog, then we go eating without washing our hands, and we get the eggs on it, and then these eggs hatch in our intestines, and they form these worms.
But if we wash our hands, we're clear.
With soap and water after you pet the dog. Real important. Now, these are real common. 5 to 14% of cat and dog owners have this.
I wonder if it's
millions here in America.
Is it based on states or regions?
No, it's just found. It's ubiquitous for the cat and dog. They have these in it.
Well, we have 2 dogs, so that's...
Well, then you're going to have it.
3 dogs.
You're going to have it. Well, just get your dogs dewormed. Let's get them dewormed, or get them dewormed on a regular basis.
Yeah.
Now, again...
I didn't know that dogs' worms could be transmitted to humans.
Oh, sure. Absolutely. But see...
We have a little dog that would do that little butt dragging thing.
Well, he had the worms, most likely.
Yeah.
Now, most cases...
If you're walking on it barefoot.
Most don't cause any symptoms.
Yeah, we're sleeping.
Most people have no symptoms with this. That's the scary part about it. Now, let me tell you a story. I had a lady, and she had a dog. And so this lady came in, she was about 60, real well-dressed, real slender. And she came in, she's a new-time patient. She looked at me and says, I just feel horrified. She says, I had a bowel movement and I passed all these worms out. And she says, I can't believe it. I says, well, you have a dog or cat? Yeah, I've got a dog. I said, well, dogs carry Toxicera, and it's common to have these parasites, but most of us don't see it. Now, she had taken some either pumpkin seeds or or something else, some type of seed, and the seeds would paralyze the parasites and they let go and then they come out in the stool. So that's how you can tell.
And sometimes our dogs will have its, not to be grotesque, but its feces stuck to its fur, and it'll jump on our couch.
Oh, yeah.
And then we find out a day later, oh my gosh, we got to cut the hair off that area or something. So it'll come, because you can't even brush it out.
Right.
So it's literally like locked in there.
Exactly.
Well, this is common
Real
for
common.
a lot of people with animals. Also, one thing I want to keep in people's mind, when you go to the beach, wild cats.
Oh, yeah.
Cats that are stray cats or stray dogs. That's why they don't allow animals on the beach.
Well, they do.
No dogs on the beach. It's prohibited. The reason for this is kids are playing in the sand,
right.
And then wild cats that are running, they'll go out into the sand and the beach and use
the sandbox.
Yeah, the sandbox is what it is.
Litter box.
It's one big litter box. So it's important that if you go to the beach with your kids, to make sure afterwards that they've washed really good after being in the sand. And I remember after one of the boys dug down deep in the sand,
yeah.
And then after getting in the sand covered, he came out, remember, and we had to do all of that. So I was
laser, I had to do all that. He had molluscum contagiosum.
Oh, I thought it was strep.
Molluscum. I had to scrape he had hundreds all over his skin.
And so you have to be cognizant of even when you go to the beach and you're on the beach and stuff like that.
But anyway, this is real common. These worms are extremely common in pet owners, but most people never see them because they don't have symptoms. They're not overwhelmed with these infections unless they get constipated and then they start having swelling.
If someone doesn't do the pumpkin seed or take some measures, they could have this festering in their system for years.
They sure can.
And just kind of, and some of the symptoms is what?
Well, again, usually they don't, unless you're infested with them. When they're infested, they cause a lot of abdominal bloating and swelling and discomfort, and they get constipated, and then they have problems or a weakened immune system. Our immune system, if we just take enough zinc and vitamin A and fiber, it literally pushes them out, and especially if you take those pumpkin seeds, it'll paralyze them and they'll expel them.
And our multivitamin has enough zinc to kill it.
Need at least 11 milligrams.
He was just telling me it today before we got here.
Well, I also think our immune support has 5 milligrams.
Right. And so, again, it's treated with toxocariasis, which are these worms I just talked about. It's treated with albendazole, 100 milligrams, low dose, twice a day for 5 days, or mebendazole, which is Vermox, 100 milligrams twice a day for 5 days. So it's just a little higher dose than pinworms. These are bigger worms, so it takes more of it to kill them. But also both fenbendazole and ivermectin and Parapurge over the counter. You can get it, and that kills them too.
And is there a negative side effect with taking this? Let's say you don't have worms, and you just want to take it as a precaution. Like what I'm thinking is, I'm just going to take it for a week, just to kind of like, if I have anything, it'll...
Right. And that's what your vet will do. He'll put them on many times fenbendazole and maybe ivermectin. Those are dewormers.
And I can do that for a week?
Yeah, you can do it for a week. Yeah, they recommend.
And there's no side effects if I don't?
Usually not. Yeah.
Okay. There's only all upside, no downside.
Yes.
Okay.
Right.
The best way to prevent toxocariasis, which are these worms in dogs and cats, is to wash your hands with soap and water frequently, especially after touching your animals, petting your animals, and before eating. That's the most important thing. Keep your pets living in a clean area, wash their bedding once a week, get the poop off the furniture, off the floor. That's where the parasites are. And then get your pet regular checkup and get them tested and treated for worms if needed on a regular basis.
Wow. It's fascinating topic. It makes me want to do the 7-day cleanse.
Oh, it does. I agree.
21-day
totally
detox.
agree. Well, I take my pumpkin seeds every night, a teaspoon at night.
We have pumpkin seed in the Ultimate Prostate formula, but I don't think women would want to take that.
No.
Well, no, but you can get pumpkin seeds. It's dirt cheap, just roasted pumpkin seeds. They're delicious. That's my snack at night, a teaspoon at night.
Well, okay, so we've gone over all the different types of parasites.
Get rid of those worms. We didn't hear a word from you.
Well, she is grossed out. She's going to talk the entire time in the next program. So next program, are we going to talk more specifically
More
about
worms. I got 10 major parasites to go over. It's just gone over.
So, okay, stay with us. We got to go over these parasites. We're going to tell you what you can do naturally, what you can do in your home. Pinworms are the worst. Stay tuned. We'll see you when we get back.
Most common.
Most common.